Akwesasne. Keith LeClaire here, the Director of Health. We're very happy to be here today because what we wanted to share with the community are issues about how can we make sure that we're taking care of ourselves. I'm joined here today with Leslie Bureau, who is the Program Manager for our Community Health Nursing teams. And we're here today to explain to you some precautions and some things that can be done to ensure that you're safe, your family is safe, your dudas are safe, and your young children are safe. Given today it's February of 2020, again, we want to make sure that our community is comfortable enough so that the anxiety and the fear about the idea of the coronavirus and the potential of having some people that are basically going through a quarantine in Cornwall, we want to make sure though that you're clear. The Mohawk Council of Akwesasne and our Department of Health are doing everything to make sure that the precautions are going to be there so that we will not interfere or harm anybody. With that in mind now, I'd like to call on Leslie to share some of the concepts of what is most important for you to take care of yourself and your family.
Hi, I'm Leslie Bureau. I'm the Program Manager for the Community Health Program for the Department of Health. What I'd like to go over today is some general precautions that everyone can do to keep themselves healthy, keep themselves from getting sick. One of the most paramount things is to keep up vigilant hand hygiene, which means washing your hands. Wash your hands with hand sanitizer or with soap and water. Also with that is, as hand sanitizers may dry your hands out, it's very, very important that you keep your skin integrity intact, which means applying lotion, doing all that. The next thing I want to talk about is cough etiquette, the appropriate way to cough. If you have a tissue, use the tissue, cover your cough, don't use your bare hands, but right after that, please, hand hygiene. And then if you don't have a tissue, you can use your upper arm like this, and then again, hand hygiene. The next thing would be avoiding touching your hands, face, nose, mouth with unwashed hands. That's one thing that can get that transmission of those germs into your body. Staying home if you're sick, staying home from work if you're ill, or staying away from other people if you're ill. That does not mean not going to the physicians or your primary health care, but that means not going to places that are public. Don't go to work if you're sick. If your children are sick, yes, keep them please at home. Make sure they see the physician if you need to, but yeah, keep them away from other people. Putting them in school actually increases the risk that they can spread their germs to other people. The next thing would be social distancing. So keeping that 6 feet away from people who are ill, who are coughing, wearing a mask when it's there in healthcare facilities. And the other thing is our elders. So in order to take care of our elders, we really need to make sure that places like Jonganusere, Yakisutta, we're staying out of there if we're ill. And in relation to the flu, those standards still exist, as well as we do offer the flu shot in the community health program. We are there for walk-ins every day, so please, we have doses there and the nurses are there waiting. And if anyone should have any questions, please look at our Facebook page. There's a lot of videos and resources on there, as well as you can call into the office. Our phone number is 613-575-2341, extension 3220, and ask for a nurse for any questions that you may have around coronavirus, influenza, or any other protective promotion related event.
Thank you very much for the opportunity to be here today. I want to make sure though that all of you leave with one important message. The coronavirus, the risk is low for the community of Akwesasne as well as other places. Bear in mind, we are always going to take care of our own, and by doing that, please take the precautions that Leslie has shared with you. Nyawagoa.